To begin with, I would like to introduce Marilee Orsini, who will be our moderator this evening. Marilee is Managing Director and founder of Core Cubed, known industry-wide as one of the pioneers of home care. Marilee has been working in home care and with home care agencies for almost 30 years. She is nationally recognized for her expertise. Please welcome Marilee Orsini.
Thank you so much, Tom, and thank you everyone who has joined us tonight. When a loved one needs care, it can really be a very, very difficult time, and most people would prefer to stay at home with care. But when you are staying at home with care, you want to make certain that that care is provided in a safe and secure environment, and that your loved one feels safe and secure with that care, and that you have peace of mind. This webinar tonight, as Tom said, is being brought to you by the National Private Duty Association, which is a nonprofit organization that serves as the voice for home care companies that offer quality care. And the webinar tonight will offer information and education to those who are seeking care for a loved one. We are very fortunate tonight to have some experts with us to do the presentation. Lee Davis of Margent Private Duty Solutions and Eldirect In-Home Elderly Care is based in Fayetteville, Arkansas. And Lee and his wife have more than 50 combined years of in-home care experience, and in that time they have served more than 3,000 seniors. Gwen Watkins is a licensed clinical social worker who has over 25 years of experience. She currently works at Wellspring Personal Care, and she's based in Chicago, Illinois, and she heads up their programming for special needs populations. We're going to cover a lot of things tonight, and our experts will cover those for you. And the first is, how does someone know when there are signs that are presenting that some assistance is needed for your loved one? We'll then define the levels of home care services and talk about related costs, and then the types of home care providers and the differences between those types of care providers, a couple of things that can be somewhat confusing. And then warning signs if you do have a caregiver in the home or have some experience with caregivers, and then also some resources to locate home care providers. So first, Gwen, what are some signs that assistance is needed? Gwen, I'm not hearing you. I'm still not hearing Gwen.
Yes, can you hear me at this point?
Yes, I can hear you now.
Oh, yes.
Thank you.
Thank you again, Marilee, for the introduction, and a warm welcome to our audience. Again, I'll be talking about the signs that assistance is needed, and determining when to intervene when an older adult seems to need help at home is a problem that many of us will face at some point in our lives, if we haven't already. We often find ourselves having to contend with lots of emotions associated with the shift in parent-child roles. Whether it's a parent or a close relative, the question becomes, how will you really know that your loved one needs help? What are some of the triggers or warning signs that we need to be aware of? The most common trigger or life-changing event might be the illness or death of a spouse. Perhaps one has been the primary support or caregiver for the other. Or maybe dad is ready to be discharged from the hospital or rehab facility after a fall, but mom is afraid that she might not be able to physically assist with his care needs. Some of the warning signs include changes in abilities, such as difficulty walking, frequent falls, memory loss, changes in eating habits, maybe forgetting to prepare meals, or you stop by and you open the fridge and you notice that there's food that needs to be discarded, meals that haven't been prepared that are sitting in the refrigerator. Those are some of the kinds of things that you might notice when you visit a loved one, and Those are real warning signs that something just may be going wrong. The other is bruising and burns on the body, particularly on the forearms and the hands. Someone may not realize that they need to use a pot holder, or they may have difficulty turning the stove off and on and are burning themselves. The other are visible bruises that might be indicators that they're falling or bumping into furniture or having other difficulty getting around the home or apartment. The other is noticing unpaid bills. Very frequently, older adults will just get overwhelmed with the amount of mail, and unless someone comes by to help them sort through, they may forget to pay very important bills like utility bills and phone bills. So you might call and a phone is disconnected and they're not sure what happened. The other sign is maybe changes in housekeeping. Someone who was an exceptionally tidy housekeeper, you go to visit mom or dad or your aunt or uncle and you notice that there's clutter, that dishes haven't been washed, laundry hasn't been done, and the person may not be sure why they haven't gotten around to doing those things. Another warning sign is lack of social interaction. And this happens very frequently when someone loses their ability to drive, or they're having to learn to ambulate with a walker, and they may just not be comfortable doing the same activities that they had done in the past and may need someone to accompany them. It's also important to note that there are different levels of care and different types of care available. The first is a nursing home, which is the highest level of care. It offers 24-hour skilled care and is the most restrictive setting. The next is assisted living, which typically offers prepared meals in a dining room. It offers residents help with some activities of daily living. And an often overlooked community-based source of care is adult daycare. And this is an option where clients receive supervision and care in a group setting and return to their families in the evening. And with many of our clients, we have found that they're able to use a combination of adult daycare in the daytime and private duty care in the evenings. And finally, of course, there's private duty home care. And as Marilee mentioned, the vast majority of older adults and disabled people, if given the choice, prefer to live in their own homes. At this point, I'd like to turn it over to Lee to talk about the levels of home care and the cost associated with those different types of care.
Great. Thanks, Gwen. Appreciate that. What I want to do is kind of trail into what, or trail off of what Gwen was talking about with the signs of assistance needed and help to define what home care really is as far as private duty. So there's going to be three basic levels we're going to talk about: the home care services that are available and their related costs. The first that I want to identify is homemaker. This is where agencies send out homemaker companions into your home. And as the name implies, it is there to help out with the household duties, the chores, the basic rudimentary services such as cooking, cleaning, laundry, errands, shopping, dusting, vacuuming. Again, those basic household chores and duties that need to be done but are not necessarily involved with the person as far as taking care of the person themselves. Just keeping those day-to-day skills, those day-to-day duties moving forward. The related cost of this is anywhere in the neighborhood of $12 an hour up through the $18 to $20 an hour. This will obviously depend on where you live, what kind of provider you're talking to, and a number of things related with that. Second level is going to be personal care. And as the name implies, this is dealing more with the person, their body, more of their personal effects, if you will. This is help with bathing, dressing, grooming, helping out with their oral hygiene, their personal hygiene. Oftentimes, and again, this is kind of a step up, obviously, from homemaker duty or homemaker companion service, where there may be a need for a plan of care developed by the agency. There may be an RN needed to help oversee this plan of care. So, again, this is one step forward from homemaker. It's called personal care. The related cost, you can expect to, and again, depending on where you are geographically, pay anywhere from $14 to $16 an hour, on up to the $18 to $20+ per hour range for personal care. And then I'm going to pass it over to Gwen for home health care and let her explain that.
Yes, thank you, Lee. Home health is often confused with private duty home care, and sometimes home health is called home care. But there is a very distinct difference. Home health refers to services provided to a person at his or her own residence according to a plan of treatment prescribed by a physician for a specific illness. This is what some people are familiar with the term visiting nurse. It's an intermittent service, it's part-time, and may include other therapeutic services such as physical therapy, occupational therapy, speech therapy, and sometimes home health aid services. The benefit is covered by Medicare and Medicaid and some private insurances. But the difference that you want to bear in mind is that the services are time limited, and they usually are associated with an acute healthcare event such as a hospitalization or new onset of an illness, and it doesn't really provide service ongoing for chronic illness. The visits are intermittent, and in order for Medicare to reimburse the service, the person must be homebound. Now, very often, private duty works hand in hand with home health care, while the home health nurse may take care of some of the skilled care needs on a short-term basis. Private duty services may also be in place at the same time and take care of some of the non-medical needs that the patient may have.
Thank you, Gwen. Lee, I'd like you now to talk about the different types of home care providers.
Sure, you bet. Thanks, Marilee. As you're going out, searching out the different types of services and providers in your specific geographic area, you're going to find there's three basic types of home care providers. I'm going to talk about those three. The first of which is the gray market or independent providers or contractors or 1099 labor, a lot of different names for that. When you are talking this particular segment of home care providers, this is usually an individual or individuals, groups of individuals, that just simply come into your home and provide care. They're not affiliated with an agency nor with any company. They're generally not insured. There's no assurance of taxes being taken out. There's no assurance of criminal background checks, of drug history, of work references, of personal references. Nothing has been generally done. It's generally just a person who comes into your home. It's up to you, the consumer, the client, to accomplish all those tasks to cover as far as the insurance, taxes, those sorts of things. The second type you're likely to run into is a registry, or registries as they're called. What this is, it's very similar to the gray market and independent or contractors in that a registry simply goes out, finds the gray market providers. They find these independent contractors. They simply refer them to you. They're just referring warm bodies to the home. They have no vested interest other than they charge the contractor a fee once they make a placement in your home. Beyond that, there's no other obligation. So there, again, much like the gray market independents, there's no credentials verified, there's no insurance provided, there's no tax responsibilities. It all befalls you. So there's a lot more risk involved with these first two, the registries and the independent providers. Some states have even gone as far as banning the use of registries for the simple fact that it's obvious that there's much more risk involved with a referral agency that they're sometimes called. And in its true fashion, it is a registry. We have seen in the news of late where there's been registries and these individual contractors that have been placed in the homes. There has been an incident. There's been an accident. There's been abuse. And the registry simply has the ability just to step back and has no responsibility for that. They say they're a contractor. We have no further dealings with them. So unfortunately, it lies in your lap, the consumer, the client, to deal with the mess that's been left by the gray market, these contractors or the registry. Third type of provider will be caregivers provided by agencies. Whole different set of rules apply with an agency, and this is where the NPDA, the National Private Duty Association, and its members kind of come into play because the caregivers that we provide must have criminal background checks. They have drug screens. They have to be insured, bonded. There is experience criteria. There's training criteria. The care staff is monitored. There's a whole litany of things that goes on that has to occur before these people are employed. And again, they are our employees. They're not independent contractors. They are. We take the responsibility of insuring, paying the payroll taxes, and the benefit to our clients is there's more peace of mind. It's less hassle than having to address all of these issues by yourself. And heaven forbid something does happen, we are there to handle it for you and help out. What we talk about now are some of the differences between the types of care providers that you're likely to see in the marketplace. So one of the big things as far as the differences between the types of cares provided is training. And what I'm going to talk here about, most of these will apply to agencies. With independent contractors and registries, none of these things will be present. So for example, like we said, training. And as we talked about earlier, there's 3 levels of training: the homemaker, personal care, and then the home health care, as Gwen talked about. So with an agency, the training is provided by the agency. This really gives the clients, the consumers, the peace of mind and knowledge that this caregiver is going to know and have knowledge on the service they're there to provide. They've been trained, they've been tested, and so we know as a company they can provide it, and it gives the client more peace of mind that they know this caregiver can provide the duties requested and required of them. Background checks. We do, as far as NPDA members, we do a variety of background checks: criminal background checks, drug background checks, work reference checks, personal reference checks. Again, a whole number of things that go into play there. With the insurance and bonding, agencies do take care of that. And as I alluded to earlier, we employ our caregivers. With my company, what we actually do, and I'm sure most of the NPDA members follow a very similar path, on their screening procedures, we have a 9-step process. The process eliminates anywhere from 95 to 98% of all applicants. So it's a lot of energy, time, and money invested into finding the good eggs and weeding out the bad seeds, if you will. We start with a phone screen where the applicant calls the company. We do go through a very long scripting of questions, and screen this person in or screen them out. If they pass the phone screen, we then move them to the phase where they'll come into the office and fill out the application. If they pass the application, we then move them on to personality testing. And we found over the last 2 or 3 years, personality testing is a very useful tool. If they pass the personality testing, we then bring them in for the face-to-face interview. And this is where the agency owner, the manager, the HR director gets to employ their skills of interviewing to really try to get to the root of this person and find out who they are and try to get a better grasp of the fundamentals of this person. If they pass the face-to-face interview, we then have them move on to sign some paperwork that says it's okay for us to check criminal background checks, drug history, work references, personal references, DMV checks, and again, a whole litany of things that we do as agencies. So again, we provide training, background checks, insurance. We also provide backup care. We call it fill-in care, a number of names for it. But the benefit is if you're at home with your mom, dad, or loved one, and your caregiver can't show up and they can't show up at 10 at night, what do? Well, if you've got a registry or a contractor, you may or may not, most likely you don't have backup care online. You don't have 24/7 care availability. And that's what an agency brings to bear, is all these things we talked about, but also backup care. And then last but definitely not least is the payroll tax responsibilities. I think we're all acutely aware of the state of the economy, the stressors and financial strain of the governments, and the federal, state, and local governments now are looking ever deeper at the relationships that these contractors have with their clients, these 1099 gray market providers. So they're taking more stern eye, if you will, towards those relationships because oftentimes there's no taxes exchanged. So there's a little more risk in the near foreseeable future for the contractors and their clients if the taxes and insurance are not taken care of. One last thing we also take care of with these payroll tax responsibilities is just compliance with state and federal laws, because the tax laws and requirements continually change. There's a whole vast array of moving targets out there, and it's tough to keep up with those. And so what we're going to do is turn it over to Gwen to let you talk about caregiver warning signs.
Yes, Lee, thank you. It's very important for anyone who chooses in-home care for a family member to be aware and cognizant of warning signs that something may not be going quite well with the caregiver. And this can happen in almost any situation. It is especially important for you to monitor the caregiver's activities, especially if there's not an agency supervisor involved. And there are some warning signs that I think most of you would pick up on, but sometimes it happens so slowly and subtly that it takes families months or even years to realize that there's a problem. The parent signing over checks to a caregiver, and this typically happens when families have gotten very comfortable and have allowed the caregiver to be involved in the financial affairs of their loved one. So they may be helping the client to write checks in the beginning, and then as illness progresses, they may actually take over writing checks. And sometimes this is very tempting for caregivers, and people are human and have financial difficulties, and sometimes they start writing one check to themselves, and then it may progress on from there. So it's really important to keep your loved one's financial information, financial records, out of the hands of caregivers, if at all possible. Not saying that there's always going to be a problem, but this is a preventive measure. Parents giving expensive gifts to caregivers can be a warning sign. Not always, but it's something that you need to be mindful of. If the parent is prevented from taking family calls, we've had situations where clients' families have called, and we may have taken over a case where the client had been exploited, and the family will say, we'd call and mom or dad would always be sleeping or having a headache or wasn't able to take a call. That's another real red flag that sometimes families take a while to pick up on. And finally, sometimes parents become suspicious of family members that they were once very close to and defer to caregivers for all the decision making. That's another warning sign that there may be some undue influence going on. And there are a couple of things you can do to prevent that. One is always make sure you have some time alone. It's just good practice with your family member. Have the caregiver get a cup of coffee or maybe run out and do an errand. Have some alone face-to-face time with your family member so that they can talk to you if there's something they're uncomfortable about. If there's an agency involved with good supervision, which is true of our NPDA members, they all provide face-to-face supervision. That's a good preventive measure. The caregiver knows that they're not operating independently and that there are watchful eyes and other people involved. And so those are some of the warning signs and some of the things that you can do to protect your loved one. Next, I'd like to talk about resources to help you locate home care providers and other services. The first are the area offices on aging, and those are the state-funded programs that provide information on publicly funded programs, including state-supported home care, home-delivered meals, and for those who qualify based on income, many of those services are paid for or at least supplemented by state funding. The other is our National Private Duty Association website. There's a wealth of information and links to our over 1,300 members nationwide. All you have to do is enter your zip code, and you'll have access to all of our members in your area with their phone numbers and links to their individual websites. With NPDA members, you know that they have to adhere to certain standards and ethics in order to remain members. They must employ their caregiving staff. So those are some important bits of information that you'll learn when you visit our website. And also, much of what we talked about this evening, you'll also be able to review when you visit the NPDA website. And also, senior centers and village township centers typically have information on all types and levels of care. If you're looking for a nursing home, assisted living, or even home care services, your village township centers and senior centers will have brochures and can provide you with that information. Additionally, your elder law attorneys are good resources. when you go in to meet with them to talk about powers of attorney for health care, and you're being very proactive about planning for the future, doing your estate planning with your loved one, be proactive and ask for home care referrals. Ask your elder law attorney who they've had good experience with, and just file that information away. Be proactive so when something does happen or there is a crisis, you'll have your information ready at hand.
Thank you so much, Gwen, and thank you, Lee. Now, we have several people that have written in questions. Let me start with Lee. Can you talk about how to finance or pay for the different home care options that you spoke about?
Yeah, that's a great question. We hear that all the time, and I think Gwen alluded to that a little earlier about some of the services that Medicaid can pay for, Medicare, long-term care insurance, the Veterans Association. Some of the specific disease associations that we're seeing are just now starting to come out with some scholarships or grants or funding to provide in-home care. Some companies like ourselves actually have grants where we provide free care for in-home care for those people if you want to call it, who fall through the cracks, fall between the cracks. So you've got private pay where the person pays out of their pocket, Medicaid, Medicare, long-term care insurance, Veterans Administration, and there's a few others, but those are the main ones. Gwen, is there any others that I've missed?
Well, aside from those that you mentioned, did you mention veterans benefits?
Yes, VA,
yeah.
Exactly, yes.
Yes, veterans benefits is oftentimes overlooked, but that's another good source of support for home care.
Thank you, Lee and Gwen. And Gwen, what do you do if a parent is resistant to having someone come in to the home to provide care?
Put on your creative cap, and this is something that we've had to do on so many occasions. Resistance is something you can overcome, and having a talk with your agency before introducing a caregiver into the home as to what's the best way to do the introduction is often helpful. They can give you some, if they've met your loved one, they may be able to offer some really good suggestions as to where to start. We start out slowly with resistant clients. We've had some instances where the family member or loved one would not accept care but would accept someone to come in and prepare meals. Well, that person just happened to be a certified nurse assistant. And over a period of months, we began to expand that person's duties from just cooking to also assisting with bathing and grooming and doing all the assistance with activities of daily living that the client needed. So starting and beginning where the client is, it's a very good principle. If they're only willing to accept a couple of hours a day, typically your agency can find caregivers who are willing to work with that type of a schedule, knowing that eventually it might increase as the client gets more comfortable.
Thank you, Gwen. We've got several questions here that are really personal to the specific situation of the person, and then we have another one that is a woman who's seeking care for herself. And I believe these questions came in before you talked about resources, but go back just a minute and reinforce whether someone has a loved one who needs care or whether someone needs care themselves. Where should they go first to find someone to provide that safe, quality care for them?
Well, as I mentioned, it really depends on the circumstances, but if this is a private pay situation and you're looking for agencies that would provide quality care, you might want to start with the NPDA website. You simply have to type in your zip code, and it will produce all of the caregiving agencies that are members in your geographic area and with links to their websites. And all of us are very willing to talk with you about your particular situation and what your current needs are. Another source would be the area offices on aging. Those are the state-funded programs. If you qualify or your loved one qualifies for state-supported home care, that's a good starting point to have that discussion to see what you might be eligible for. That can be supplemented with home-delivered meals. Again, this is based on income. But for just general private duty home care services that are private pay, you'll want to take a look at the NPDA website. That's a really good source of information.
We've also got someone who just asked, you've been speaking, both of you, on elder care, and what about care for someone who has a dementia? Would that be different in seeking care?
I think there's a pretty broad net you need to cast out there to find the right agency specifically for dementia. There's a lot of agencies that are great in-home care providers, great private duty providers, but you need to ask a lot of pointed questions, and Gwen may have some more input on this after I finish, but there is a large difference, as we all know, between just general caregiving and then working with and having a relationship with someone with dementia. My grandmother had Alzheimer's for over 10 years. We had to deal with that. And we had some great experiences, and we had some really bad experiences with agencies and some individuals. So we got to see the full gamut. But I would seek out companies and ask a lot of questions first about what they specifically do for dementia patients, how they've handled it, and then get references. Lots and lots and lots of references. Go to your trusted healthcare provider, ask them who do they know and who would they recommend, and then find those people and ask a lot of questions. And again, like Gwen was saying, the NPDA and all of its members will be happy to provide more input. This is an abbreviated explanation, of course, but ask a lot of questions, find trusted advisors, and ask them who would they go with.
And also, if I might add, Lee, ask questions about their training, their caregiver-specific employee training on dementia. How do they prepare their caregivers to deal with people at different stages of dementia? And their response may also help you to decide. Not everyone has specific training on dementia.
We have some more questions, but they're very specific to an individual, and I don't really think would be appropriate for the entire group. I don't think it would. So my suggestion would be that I believe, and I'm hoping that our chairperson or Tom can answer this for me. Can we answer a couple of these questions via email?
Directly, absolutely. We'll be happy to do that. We've got everybody's contact information, and I think that's a really good solution to that.
Okay, because there are some very, very specifics, and as Gwen said, most of the agencies that are members of the National Private Duty Association will gladly speak to you if you find one in your area and call them. But we've got another question that is a pretty broad one, and I don't really think we could answer it tonight, but I'll tell you what it is. What changes are expected due to the Health Care Reform Act?
Well, I can take a stab at it. I think one of the possible changes that might occur, and we don't know if this is going to happen, but it's been proposed, is that there be some support, financial support for long-term care insurance, and that those policies be made more affordable. And there is a mechanism that's been proposed. I don't know how effective it's going to be or even if it will happen. But I know one of the prohibitions for a lot of us to buy into long-term care is the cost. It's quite prohibitive. So if there were a way to pool enrollees or participants so that you had greater numbers and perhaps a lower monthly cost, we'd have more people able to afford long-term care. And that would be a wonderful thing to make it more widely available. And to younger people as well. They're looking at expanding the age range of people who buy into long-term care.
Gwen, you mentioned going to an elder law attorney. Where would you find an elder law attorney if you were seeking one?
There is a National Association of Elder Law Attorneys. They have a wonderful website. Some of them are listed in your yellow pages specifically as elder law attorneys or estate planning attorneys. And those are two of the best resources that I know of, and word of mouth, talking to other people who have had good experiences with their estate planners.
Okay, good. And also, there's someone who's looking at the NPDA website and says there are no NPDA member agencies in his area. So, what questions should he ask the care providers that are in the area?
Well, I think he or she can actually, again, call the healthcare providers in the area, the medical professionals, and see if there are any agencies in the area, if in fact that's the direction this person wants to go. If you're only stuck with registries or independents, then you're going to want to ask, like Gwen was saying about the training, about the certification, about what do they do, what have they done. Ask some very pointed questions, get some very specific information. Their training, their certification requirements, what certifications do they have? Can they produce a criminal background check? Can they produce a clean drug test? All these things that we talked about that agencies provide, an individual can do. It's a little bit harder to perform, but it can be done. So those would be the things I would encourage you to do, would be to look at those specific security criteria, if you will. If in fact you are stuck with a registry or an independent, but my recommendation would be to first call healthcare professionals, see who the providers are, if there are any in your area, and start with that.
Excuse me. Another question, when you're doing the background checks, does the family see the background checks?
If they want to see them, you bet you will produce them. We have our caregivers sign an agreement that says it's okay for us to disclose this information. We want to freedom of information, if you will. We want for everybody to be open and honest about what we're seeing here. And we don't hire anyone that has a criminal background. That's just not something we do. So we're more than happy to provide disclosure of that.
Good. Gwen, do you also share background checks?
If it's requested, most definitely. If families do request to see references or information about, I haven't had anyone to ask to see the actual paper, but we certainly will disclose with the employee's permission the results of the background check and references.
Okay, I think there are several other questions, but again, they're very specific to some, very specific things. So I would, one though that is not, is talking about the actual cost of care and the maximum number of years that one could possibly need this care, the type of care.
Now,
well,
go ahead, Gwen. I'm sorry.
I was going to say the number of years. Like, is there a time limit on the number of years? It's really difficult to say, and we have clients who have lived to be 103. We have clients who are 99 and 100. So, certainly we feel very proud of ourselves when our clients have good quality of life and they're living as long as they are. But there is no time limit. I think you can have care for as long as the person is comfortable at home with private duty care. I certainly don't think there's a time limit on it at all.
We actually had a client that we provided 24/7 round-the-clock care for 9 continuous years before she passed. So it can be unlimited actually in the grander scheme of things.
And there's a question here about reimbursement from the Veterans Aid and Attendance Program, and I don't know if you want to go into that level of detail. How much money could someone expect to get to supplement the cost of care?
I think it's best to say that it's going to vary greatly depending on the region. Each VA is set up differently depending on the geographic region. They call them VISNs. The VA, there's some more terminology there, but it's VISNs, and each VISN has its own different allocation of money. There are different corollaries, different formulas that they use. So that would be definitely a moving target, and one I'd be afraid to answer because it would likely be wrong.
Okay, let me ask one more. How unusual is it, or how usual is it, for the home care providers to have all of their meals provided for them by the family and to take their meals with the family?
Well, I could say, again, it depends on the circumstances. With our caregivers who stay overnight, and they're called live-in caregivers, they maybe work 3 days or 4 days in a row. In most of those circumstances, the families provide the meals. Now, that doesn't mean that the caregiver is sitting at the dinner table. It may simply mean that the family has allowed the caregiver to share in the food that they have available. In many instances, the caregivers may eat some of the family's food items, but many of them bring in their items from home as well. So that's true of our people who do overnights or live-in. Those who are there for maybe 8 hours a day, they typically bring in their own food, their own breakfast, their lunch. If they work a 12-hour shift, they'll typically bring in something for dinner that they're able to heat up. But it is, with some of our older adults who live alone, they want the caregiver to sit at the table. That's company for them while they're enjoying their meal, stimulating conversation, and we certainly encourage that if that's something the client wants.
What about when you have a client who is moving from one level of care to another, so someone who has companion care and then moves up to need personal care? How does an agency manage a case like that?
For us, we offer, of course, the homemaker and personal care. So when they move from one level to the next, we're able to accommodate that. Now, taking that to the next level of home health, we work with agencies like Gwen's. We have a very broad network that we work right alongside of, where we may be there just for a few hours a week to help out with cooking, cleaning, laundry, a little bathing and dressing, and then the home health agency comes in on their hours to provide more skilled care. So that's how we handle it. Once the person's needs permanently exceed ours, then we want to defer on to the home health agency to make that determination what's going to be the best placement, or their doctor, or their nurse or case manager, what's going to be the best placement and service for that patient.
I have a question here from a woman who actually has hired independent contractors, independent caregivers, and they have signed an agreement that they are independent contractors, and they're supposed to report their income and pay taxes on what the client is paying them for the care. And the question is this legitimate?
That's going to be an accountant question.
Okay.
Without knowing all the paperwork that's been signed and what is and is not being taken out, withheld, and disclosed, I would definitely defer to an accountant and just verify. And it's good that you're asking that question, because you want to be compliant with all state rules and regs, and you can get a very heavy slap on the wrist if you're not. So contact your tax professional, ask them, show them exactly what you're doing, make sure you're compliant, and then you can sleep well at night.